Hey, guess who? We can go to dispute this because I'm getting several of you with some really big requests for recoupment. So let's go to the slides and let's talk about what is going on. And this is coming directly from the VA, which is VA Community Care. And again, it's the care for veterans. You have to be enrolled. And remember, if you're on the East Coast, you will be enrolled through Optum Health. If you are in the West Coast, and now when I say West Coast, let me say Texas and west of Texas, you're going to be through Tri West. But it's happening in both areas. And what it's relating to is you're getting letters that are coming to you saying, hey, we paid you money we shouldn't have. And we want it back. Pay us back. And if you don't, we're going to take it out of future payments. So we want to talk about how do you really respond to this, what's gone on, and what we need to do. Part of it I'm going to say to you is this is why I hope that many of you are network members with me because you would have avoided this whole thing had you known or been part of that. We did go through that last year a bit. So many of you are getting letters similar to this one, like TriWest. I'll leave this one small, but what this does is it's just saying the purpose of this letter is to inform you that pricing information allowable reimbursement on claims previously paid to you has been adjusted. Given the correct payment is lower, we want some money back. In this case, $388. Now, that's not very much, but I don't like paying anything back when I do not have to. So let's talk about what has gone on specifically and what is the issue that's happening. Well, how do you overpay it? I mean, let's face it, fees paid for the VA pay at your state Medicare allowable. So how could it be wrong? I had someone that sent me a letter and said, hey, Sam, I went through all my pricing and this is what they paid me before. How could this be possibly overpaid? Well, there could be two issues here. One of them is called the multi procedure payment reduction. And what this refers to is that secondary services on a claim. Now, I'm not talking acupuncture exams, but therapies, by example. If you're billing a therapy, the first therapy is paid at 100% of its normal rate. But then each subsequent therapy on the same day is reduced what's called the practice expense ratio. And what this refers to is the practice expense of a service goes this way. By example, let's say I'm going to do massage for an hour. I have to do a certain amount of setup for that room. That's the practice expense. Well, that practice expense doesn't have to be done if you think of it. If I set it up for the first 15, do I reset it up for the next? We don't. So what they're doing is reducing that portion of it. Now that practice expense comes out to about 15%, 20%. So it's not a big amount. Let's say the code is worth 30. The multi-procedure reduction would be that it would be paid probably at about 26 or roughly about 15, 20% difference. So not a big difference, but nonetheless a difference. Now that's something they should have been doing and they didn't. So that's really on them. My pushback is going to be at least partially on that. However, for acupuncture, the biggest issue is not that because those would be small potatoes. We're talking $3, $4. It is the use of 97039 and 97139. So when you get this letter, what you want to do is verify with them how are you indicating it's overpaid? Is it overpaid because of the procedure reduction portion? Or is it being overpaid because I used 97039 and 97139 for cupping? Please be aware, since February of last year of 2024, 97039 and 97139 were no longer part of the standard episode of care for acupuncture, which meant you could no longer use it. I'm hoping some of you go, oh, yeah, I remember when that happened, and you were no longer to use that code. Now, of course, if they were allowing it, and they were, prior to this change, 2024, they were allowing you to bill 97039 for cupping. And frankly, many of you were getting paid $45 to $50 for it. So if someone's willing to do that, I'm willing to take it. However, let's keep in mind, let's think about that logically for a second. Cupping is a much simpler service than acupuncture. Yet you are getting paid more for cupping than acupuncture. So you can kind of look and go, well, that doesn't make sense. However, because they allowed it, I'd say go ahead. Technically, you should have not been using it after last year. Realize here is the newest list of codes allowed for acupuncture with the standard episode of care since February of last year. And you'll notice immediately none of the 970 or 9713, 97039 or 97139 is included. They were removed. Now, the pushback that I have, if you're getting a request for a refund that was prior to February of 23 for the data service, the standard episode of care up to that point did include it. Therefore, it would be appropriate for them to pay. And the pushback would be, hey, it was allowed at that point. Now, if you are getting requests after February 23rd, now that's a whole nother issue. That's one that, oh, shucks, we should have known. Now, network members with me, you should have well known because I sent out a lot of information. This is why I'm sending this all directly to you as well, not to mention just for everyone. Let's make sure you understand if you're billing the VA, these are the codes they allow. They do not allow 97039. If you are wanting to do a service that is not on this list, you must specifically get authorization from the VA to provide it, or it's automatically non-paid. Now, I will have you notice the last two codes in each one, the 0552T and S89, or excuse me, 0552T is the code for laser. Laser, don't get excited, it doesn't pay that much, but it is covered. Line is do not 97039 or 97139. Do not use them. They're going to be a problem. And if you get paid, you're thinking, well, I got paid. They're going to come back and take it back. We're going to push back on that a little bit. But again, after February of last year, it's going to be a little bit harder. So for cupping, what should you do? I'm not saying not to bill for cupping. I'm saying for the VA, however, it is only under 97016, and that code, frankly, is worth between $11 and $15, which truthfully makes much more sense to me. I don't think cupping should have the same value as acupuncture. Not to say that cupping doesn't have value, but is it as much as doing the needling? I think not. So therefore, yes, it's still payable, but just under that code. Now, if you're getting issues on the price reductions, that's one I would still push back on depending on when they're implementing. But remember, that's going to be a pretty small amount. If it's a big amount, I'm almost certain it's going to be cupping. So make sure you're pushing back. How can I dispute it? Well, the number one dispute I have, and this is the starting point, but I want always there to be two disputes, is just plain statute of limitations. Let's face it, we have only 180 days to bill the VA. Does that give them infinite time to recoup, years later? No. Under federal statutes, it's 365 days or 1 year. Therefore, if they're making a request to recoup money from you that is over 365 days or 1 year, that's the number one pushback. If you're a network member with me, please contact me. We have a dispute letter to that fact for you already formatted that you can send. Hopefully this has encouraged some of you. Oh, this is why that network is so good. Anyway, if you're not a network member, you're just going to have to go back and say, hey, that's statute of limitations. I would also push back, though, on this issue. Case law. There's case law that's been around since the 90s that says when an insurance pays something improper and the provider has not done anything to make that payment improper, the carrier is the one responsible. Under federal rules, they may push back on that, but if you recall last year, we were able to dispute that, and I'm expecting the same. So my hope is that given in another month or so, we should see some pushback where they're going to no longer seek these recoupments, at least the ones prior to 23 or over a year. My concern for you, though, is make sure you understand, do not bill 97039. I know you're thinking, well, they paid me. They can recoup it. We want to push back. Let's make sure the claims are correct. If you're not a network member with me, this is a great time to understand what we do. This is something we're trying to get you ahead of the curve and not chasing after it. VA patients are still very good patients. Remember, we got about a 20% increase in the Medicare fees for the first set this year. So that's a good patient. Just understand the rules. Again, no use of cupping. If you're not a network member, please take a look. If you're a network member, please contact me. Let's go through. We can do a one-on-one Zoom if we need to, but let's make sure we've got some fire to push back on this. And